Good afternoon, Dr. Christiansen. Sorry about that.
It's fine.
Dr. Christiansen wasn't born here, but she did go to Bishop Gorman High School. She graduated from the University of Pennsylvania, and she went to the University of Nevada Medical School in Reno. So she has roots here. She grew up here. She's currently working here at Comprehensive Cancer Centers. She is a board certified oncologist and hematologist, but a bulk of her patients are breast cancer patients. And so we wanted to just take a few minutes. There's a lot of information going around out there about what's going on with COVID-19 and breast cancer, or any cancers for that matter. And I'm sure that a lot of this would apply to all cancers, but we had a lot of questions come in from a lot of different areas, even from other states. So I just wanted to address a few of those today, but I just wanted to say thank you so much for joining us. I know that your job hasn't stopped, right? I mean,
Nope, it has not. No, we're still seeing patients 5 days a week.
5 days a week. So are all the clinics still open?
Yeah, all comprehensive clinics are open. We are trying to limit patients to the clinic that only need to be there for medically necessary reasons. So if someone's on chemotherapy, we're still seeing them. If someone is sick and has a problem and needs to see their doctor, we'll absolutely see them. Patients in long-term follow-up who are well, who have no concerns, we're trying to switch over where we're pushing those visits back, and hopefully in the next couple of weeks we may be able to do some televisits to via modalities like this, so they don't actually have to come to clinic to limit exposure.
Oh, that's great. So along those lines, actually, that is one of our first questions that we got. It is obviously the most popular question, and I totally say why, but it is, should I stop my treatment while this is going on?
Every medical decision you make is an individual decision between, a patient and their physician. So ultimately, it should be between, your doctor. But in general, we're not stopping. The thought is that the cancer that we're treating you for is a threat to your health, and so we want you to take necessary precautions to social distance and avoid potential exposures. But we don't plan on stopping treatment unless various particular reasons that would be between you and your physician.
So you say consult your doctor, your own personal doctor.
Yes, absolutely.
Okay. Well, and along those lines, like you said, the clinics are open. Are the comprehensive cancer centers taking steps between patients?
Yeah.
Is it any different?
So absolutely. So we're fortunate in that we've always dealt with an immune compromised population. So I think we're ahead of the game in terms of the hygiene procedures and whatnot we take in our office, but we have stepped it up. So outside every clinic, we have screening, which is looking for high-risk individuals. If we think someone's high risk, we're deferring them to other health resources before coming into the office. Patients who are symptomatic or for any reason are provided with a mask, as are the healthcare workers that are exposed to that patient, and gloves and anything else that is necessary.
Okay, great. So one of the other questions that I got, and now mind you, I'm not going through chemo, so I don't totally understand, but does chemo affect their odds of getting Corona-19?
So it doesn't necessarily affect the odds of getting it, but it may affect how susceptible you are to, or how severe of illness you get from it. So in general, chemotherapy can weaken your immune system. It can drop your white blood cell count and weaken your body's normal defenses. So if you are exposed to a virus, your body has fewer resources to fight off that virus, and you can become sicker from that standpoint. We do know that cancer patients have a higher likelihood of ending up in the ICU and on ventilators from COVID.
Oh wow! So a lot. I'm assuming now there's no cure at this moment for the virus, but people on medication for chemo, can they continue to take those medications while they're in the hospital, or will they need to stop, or what's that protocol?
Yeah. So again, that probably it probably falls within the scope of their own disease, and every disease is different. But in large part, if you're hospitalized from COVID-19 to the point where you're needing a hospital bed, potentially an ICU bed, potentially a respirator, we generally stop treatment, the cancer treatment at that point.
Okay. So, and that's not a bad thing, right? I mean, like, are we feeling that this is temporary enough disruption?
Yeah, and that's not very different from just any sort of illness. So generally,
Okay.
you know, if I had a patient on chemotherapy who was hospitalized for a run-of-the-mill pneumonia or the flu or something else, in large part, we often stop it while they're in the hospital and then resume
Okay.
once they're stable and have been discharged.
So it's not any different than any other scenario that they'd possibly be under.
Yeah, there's nothing special about COVID in regards to that.
Okay, good. Okay. One of the questions, and I don't know, I imagine this is also personal preference in a lot of ways, but you know, a lot of these people suffering from breast cancer are married, have kids, are grandmothers, grandfathers, whatever, live in houses with other people. What is it? Move out into a hotel and stay by yourself, or is it don't talk to anybody, lock yourself in a room, or is there in between?
So yeah, I think our recommendations haven't changed that much from our normal recommendations with chemo, meaning you know, most people are living at home with families, with children, with spouses who and may be exposed to you know, vectors of other sources of disease. Generally, if someone's sick, we recommend our cancer patients isolate themselves from that sick person. Certainly, if that person is suspected or known to have COVID, we're recommending per the CDC guidelines that they self-quarantine and self-isolate so they can't be exposed to that person. But in general, I don't think they need to do any, you know, extreme isolation, living with their family who's generally healthy.
Perfect. Good to know. So, and actually, you actually covered this question, but I wanted to talk about it just for 1 second. If my immune system is weakened, will the effects of my cancer grow?
I don't think there's any data to suggest that, no. I don't think COVID is any known association with making cancer grow faster or slower.
Okay. And because it's something that's standard practice, if you have so stopping your treatment for a treatment of another issue is not like a drastic measure, right? It's just something you do all the time anyway.
Yeah, something we do all the time. I mean, ideally, we like to stay on the set course that we've set out at the beginning, but stuff always happens. So in all sorts of treatments, there's treatment delays for one reason or another, and we deal with that as that comes.
Do you find now you're still seeing patients even right now, not this second, but I mean, you know, today, tomorrow, whatever. Do you find that the concern is high, or are you able to keep it?
No, I mean, we're all concerned. I mean, I'm concerned as a healthcare provider. I'm sure you're concerned as just a member of society being in public.
Yeah.
You know, and cancer patients, especially those on treatment, have every right to be more concerned because they are going to be immune compromised. So yes, absolutely. We're getting, you know, hundreds of phone calls a day.
Are you really?
Yeah.
So that's actually, I mean, that's good. I'm glad to hear it. I'd rather people pick up the phone and get accurate, you know, usable information. I've noticed that there's so many pieces of information out there, and I avoid the news because you're right. It's distressing. I'm a human being. What's happening is distressing. But I did manage to hear, don't take aspirin. Now all of a sudden, don't take aspirin to reduce your fever, or like, do you think that these things are just, I don't want to say sensational because I'd like to think that everybody wants to help, but it's not enough time to like test this out, is it?
Yeah, I think I completely agree with you. At the present time, there are no active recommendations from the CDC to avoid any particular medication. So certainly if there's a drug you're concerned about, you know, you should speak to your, you know, your healthcare provider about that drug. But I wouldn't take it upon yourself to stop anything based on something you know, saw in the news or saw on social media right now.
Okay, I was thinking that very same thing. And yet I did call my sister and say, oh my gosh, apparently we can't take aspirin. But then I took aspirin. So I'm back. And the other thing is like, then I hear, you know, it's more susceptible through your eyes. So I know there is a lot of information out there. On the flip side of that is, what is your thoughts, if any, and this is a surprise question that just came to me right now, on people are racing to find a vaccine, which I'm happy about because I'd love to find a vaccine. But we spent so much time testing, doing clinical trials and all that, that the idea of coming up with a vaccine in the next, 3 months seems impossible. If they do you think it's worth trying? I don't know. This is, again,
well, any vaccine that's going to be made accessible to the public is going to be tested before the average Joe is going to be able to get it. So, okay. I mean, yeah, so certainly they're working on that right now. The numbers I've heard is, 12 to 18 months before.
12 to 18 months. Okay. All right. I'm going to ask another question. Again, this is my own question, but I just realized I had it. So if this is out of left field, has there been any research or studying or knowing about if you get it once, are you more immune to get it a second time?
Well, that's what we believe with any virus exposure is your body's exposed to a novel virus such as COVID-19, and it develops antibodies, and those antibodies stick around so that in subsequent exposures that you have a defense ready to attack.
Got it. All right, so I have 2 more questions. One is, I know that you have these though. One is, actually maybe not, but I wanted to ask, so the things that apply right now that we've been saying all along: stay home, try and avoid physical contact with people just in case, wash your hands, cover your mouth when you cough and sneeze. Is there something else any other cancer patient can be doing above and beyond those things, or is that really going to cover it?
I mean, I think you nailed it. Yes, social isolation. If you have to be out in public, staying 6 feet from the closest person. Washing your hands if for at least 20 seconds. Using hand sanitizer if that's not available. If you do have to cough or sneeze, trying to cough into your sleeve. Don't touch your face, which is really hard. I've touched my face since I've been sitting
Oh my
here.
gosh!
Yeah.
How many times have I done it already today? Yeah.
And in trying to avoid anybody who is sick, and certainly anybody who has been exposed or has the potential to have COVID-19.
Okay. And then, is there anything that you have found in your practice in the last 3 or 4 weeks that we should be sharing with our breast cancer survivors that I've missed?
So a couple things. One question I get asked all the time is a lot of breast cancer patients, after they complete treatment or complete surgery, get placed on hormonal therapy. So they're on drugs like aromatase inhibitors, which are anastrozole, letrozole, exemestane, or a drug called tamoxifen. Those patients generally are not immunosuppressed above and beyond the average patient. Certainly if they have other health problems like heart disease or diabetes, or if they're a smoker, they'd be at higher risk. But the hormone therapy by itself does not make them immune suppressed unless it's combined with a chemotherapy agent, which we do sometimes in stage 4 breast cancer. So I think that's important. I think certainly if you're concerned that you have been exposed or that you may have the disease, I think it's better to call your healthcare provider or even the health department rather than racing to the emergency room if you're stable, just so that to limit exposure through the emergency room as well. I think those are probably the 2 biggest things.
Oh, that's that's probably a good idea for all of us as well, right?
Yes,
absolutely. I'm the most social person I know. I'm touchy-feely and I like talking to people, which is why this is fabulous. But it has been a lesson for sure.
It's hard. Yeah, I walk into patients' rooms and it's very awkward not to shake their hand hello.
Yeah. Yeah. So, Dr. Christensen, I cannot tell you how much we appreciate this. I feel it's better to be able to talk to people about what's going through your head, to calm your nerves. And so I do totally appreciate you joining us today. We couldn't do it without you, obviously. I do appreciate Comprehensive Cancer Centers. They support Susan G. Komen in so many different ways. And it's great to have partners like you that really care about the community, and we totally appreciate it.
Well, we appreciate how much Komen does for the community as well. So
thank you.
Thank you.